All right, team. There's a couple interesting developments that has happened over the last month or so. One that actually wasn't on my radar. I'm a little disappointed in myself. But I want to be the one to bring it to you tonight in case you also feel like you missed out. Are you aware that Delta Dental purchased some practices in Wisconsin? Yep, that's right. This is a new age and a new dawn of dentistry. Now that we have dental insurers starting to purchase practices. So in July, early July, Delta Dental purchased Cherry Tree Dental out of Wisconsin. Yes, I said the state correct. Now it raises some pretty serious concerns about conflict of interest, perhaps. Maybe that practice will only accept Delta Dental. Maybe they'll be able to do price controlling. And what will that look like depending on the number of locations and its distribution throughout the state? What will that look like for the other dental providers who also participate as an end network provider for Delta Dental in the state of Wisconsin? And where's their next target? What state will allow an insurance company to come in and purchase additional practices? I don't know about you, but this concept has not been fully vetted, and it leaves me pretty icky in the tummy on where this will go with dentistry. So I don't have any updates, but I think this certainly is going to have to be under review. I think it could be potentially some legal ramifications and some regulatory implications that will come from this. I guess we'll get the luxury of the hindsight review. Remember, Wisconsin's really been pushing the envelope lately on what they've been allowing to happen in their state. They were, in fact, the ones to allow their new dental graduates to bypass a hands on in person clinical exam for licensure. They are opening up the compact and allowing interstate commerce of dentists and dental providers to come across state. And they also are a pretty big advocate for mid level provider. So, as dental patients of Wisconsin, read the fine print. Another story coming out of Florida. We haven't seen a lot of activity in the amalgam space in a bit, but the general surgeon or surgeon general, gosh, surgeon general is late. Florida just came out advocating against the use of amalgam for restoration. Now we've seen this uptick a little bit in New England and a little bit on the upper northwest coast of the U.S. A lot of campaigns against the use of amalgam. It'll kind of simmer up and then it comes back down again. But now we're seeing more and more states starting to verbalize how they feel about amalgam, not just from the regulatory piece of the EPA and how the amalgam is entering the water supply and how we protect and minimize that impact. But now we're seeing for the first time actually in a bit, a state kind of coming online saying that they're going to be advocating for no more amalgam restoration. So I'm sure that will open up a floodgate of discussion. I'm sure it will open up a floodgate of lobbying and discussion about whether or not so goes Florida, so goes the rest of the union. Who knows? But another restorative material is up for debate. And we know fluoride has been a hot topic for a while. That hasn't stopped. I think obviously the nomination of RFK and Confirmant is continuing to sort of simmer that pot just a bit. And so there's been a couple of things that have happened over the last few weeks. One of them was a coalition that put together an advocacy group to go against the fluoride management, I guess. So they put together an act called the Teeth Act, largely Democrat supported act that is intended to require the EPA to go through another organization for independent, non biased review when it comes to the regulation of fluoride in the water supply. Obviously, dental organizations are supporting that because of the push to eliminate fluoride in municipal water supplies and to get an independent review from a scientific group to make sure that that is in the best practice. So, again, fluoride is a hot topic, top of bill for discussion. And with that, that's the news.